Gentlemen, let me ask you something. Have you ever had a question about intimacy that you were too embarrassed to ask out loud? A question that stayed in your head. One you searched quietly online late at night. One you never brought up with your partner because you didn't want to seem awkward, inexperienced, or disrespectful. If so, you're not alone, not even close. I'm Dr. Jocelyn, a urologist and men's health physician, and for the past 5 years, I've sat across from men of every age, men in their 40s, rebuilding confidence after divorce, men in their 60s discovering love again, men in their 70s still wanting closeness, connection, and dignity. And I can tell you this with certainty. The questions men are most ashamed to ask are usually the most human ones. Today's conversation is one of those. It's not about being graphic. It's not about pushing boundaries. It's about understanding the body, protecting health, and deepening trust. So intimacy feels calm, confident, and connected instead of anxious or awkward. Before we continue, take 1 second. Tap the like button so this message reaches more men who need it. Subscribe for weekly, doctor-guided men's health advice. And tell me in the comments, where are you watching from today? I read every single one. Now, let's talk honestly. Many men quietly wonder about vaginal fluids during intimacy. Is it normal? Is variation okay? Does it mean something about health? And most importantly, how do you approach this topic without fear, shame, or hurting your partner? The reason this matters isn't just biology. It's confidence. It's closeness. It's whether intimacy feels natural or tense. And here's the truth most men don't hear. When you understand what's normal, what's healthy, and how to communicate with calm respect, intimacy stops being stressful and starts being deeply bonding. So let's gently clear away the myths. One of the biggest myths men carry is this: that vaginal fluids are somehow dirty, toxic, or a sign something is wrong. That myth has caused more anxiety, more awkwardness, and more emotional distance than almost anything else I see in my clinic. Here's the medical truth spoken plainly and respectfully. For healthy individuals, vaginal fluids are a normal, protective part of the female body. Biologically, they exist to protect delicate tissue, maintain a healthy environment, reduce friction, support comfort and natural intimacy. They are not a waste. They are not dangerous by default. And they are certainly not something to be ashamed of. Now, here's where men get confused and where fear creeps in. Because vaginal fluids vary. They can change with hydration, diet, stress, hormones, menopause, medications. That variation is normal, not alarming. Emotionally, when men don't understand this, they often internalize fear. What if I react wrong? What if I offend her? What if I seem inexperienced? And practically, that fear shows up as hesitation, jokes, avoidance, or silence, none of which helps intimacy. Understanding biology removes the fear. Understanding the emotional impact restores dignity. And understanding how to communicate transforms connection. That's why this conversation matters. In my 5 years as a urologist, I've seen how unspoken worries around intimacy quietly damage confidence. Men rarely say, "I'm scared." Instead, they say, "I don't feel like myself anymore. Intimacy feels awkward. I worry I'll mess things up." I remember a gentleman in his early 60s, recently widowed, newly dating. He cared deeply about his partner, but was constantly anxious during intimate moments, not because of performance, but because of uncertainty. Once we talked openly about health, communication, and what's normal, his entire posture changed. He said something I'll never forget. "I didn't need techniques. I needed understanding. That's what most men need, not tricks, not bravado, clarity, and calm confidence." And that brings us to the most common mistakes men make, not out of bad intentions, but lack of information. Mistake number 5, assuming normal means identical. No two bodies are the same. Variation does not equal danger. Biology. Hormones and hydration affect natural fluids. Emotionally, assuming something is wrong creates anxiety. Practically, learn what's normal for your partner, not the internet. Mistake number 4, interpreting taste or scent as judgment. Bodies reflect lifestyle, diet, stress, sleep, biology. These factors influence natural chemistry. Emotionally, judgment creates shame. Practically, curiosity and kindness preserve trust. Mistake number 3, forgetting health conversations. Yes, fluids are usually safe in healthy couples, but health status always matters. Biology. Infections can exist without symptoms. Emotionally, avoiding the topic creates fear. Practically, testing together builds trust, not distance. Mistake number 2, avoiding the conversation entirely. Silence doesn't protect intimacy, it weakens it. Biology. Knowledge reduces unnecessary worry. Emotionally. Openness feels safer than guessing. Practically. Calm, respectful discussion strengthens bonds. Mistake number 1, responding with shame instead of acceptance. This is the most damaging mistake of all. Biology. Stress shuts down arousal and comfort. Emotionally. Acceptance deepens connection. Practically. Kindness keeps intimacy relaxed and natural. Here's your simple, grounded action plan. Normalize the conversation. Talk calmly, no jokes, no judgment. Make health a shared priority. Testing together is responsible, not awkward. Stay hydrated, rested, and attentive. Bodies reflect care. Approach intimacy as teamwork, not performance, not pressure. Respond with reassurance. Acceptance builds desire more than anything else. These are not romantic tricks. They are foundations of mature intimacy. Gentlemen, hear me clearly. You are not too old for closeness. You are not strange for having questions. And you are not failing because you want to understand. Age does not end vitality. It refines it. With age comes patience. With patience comes confidence. And with confidence comes a deeper connection than many younger men ever experience. If this video helped you even a little, like it so more men can learn without shame. Subscribe for weekly guidance on men's health, confidence, and vitality. And comment below, what part of this conversation resonated with you most? I'm Dr. Jocelyn, and I'll leave you with this. Your health protects your confidence. Your confidence protects your connection. And intimacy, when guided by respect and understanding, only grows richer with time. Take care, my friends. Your best years of connection are still ahead.